Hello, everybody. Thank you so much for watching this live on my YouTube channel. So today we're going to be having a Q&A for nurses that are also moms. And so we're going to go ahead and get started. And the first question is, how do you manage your time effectively to fulfill your responsibilities as both a nurse and a mom? Okay, so at the beginning, it was so challenging to balance my time being a mom and a nurse because I didn't really know what options were out there for me. But there is so many options that you have if you are a nurse and a mom because there's different schedules that you can choose. You can choose Monday to Friday, which is like a full-time job from 8 to 5. You can also choose 7 to 3. You can choose per diem, which means that you don't have to work all the time. You can choose what days of the week you want to work. And the second question in this Q&A is, what strategies do you use to prioritize your work and family life when faced with conflicting schedules? Okay, so I obviously have set my priorities. So at the end of the day, we're just working to have fun with our family. We're trying to make enough money to go out on vacations and be able to do fun activities with kids. That's what our job is at the end of the day. And so when I have those priorities straight, I'm able to prioritize certain things. Sometimes I have to say no to very awesome opportunities in my job that won't like necessarily risk my professionalism. But I do say no to certain things just to be with my family because they are my priority. And so the third question on this Q&A for moms that are nurses and work. So how do you handle unexpected situations at work while ensuring your child's needs are met at home? Okay, so I have a toddler. She's 3 years old and she's always demanding my attention. So I make sure that when she comes home, I'm no longer working. It's very hard to try to give her my full attention and honestly not experience mom guilt without giving her my 100% full attention. Besides the fact that she will be like telling me, mommy, I need this, I need this. So I won't be able to do two things at the same time. So you honestly can do whatever you set your mind to, but it's just hard to do two things at the same time. So I always remind myself, Clarissa, you can do everything as long as you're not doing it at the same time. Because I mean, we're not an octopus. We don't have so many hands to balance so many things at the same time. And the other question for this Q&A for nurses that are working moms, what are the biggest challenges you face in finding reliable childcare that fits your nursing shift patterns? So like I said, you should look for a company that values you as a human and as a person and your mental health. And so you can always discuss this with your manager or supervisors. Let them know upfront that you do have kids and you're looking for flexible schedules so nothing unexpected for you or your employer arises in the future. And then the other question is, do you prefer set shifts or flexible scheduling to better accommodate your family needs? And to me, it just depends. So I'm very lucky because I work for an amazing employer who allows me to have flexible scheduling. And so I do personally prefer that. That's just my opinion, but it just depends on your needs, on your personal needs, on your financial needs, things like that. The other question is, how do you communicate with your employer about childcare needs and potential scheduling conflicts? And so as a nurse, you usually have patients scheduled. And so in order for you not to lose your license, you need to make sure that the patients are taken care of, especially if they're scheduled. So having very strong relationships with your coworkers will help with this. And the next question is, how do you cope with the stress of demanding nursing job while also being a primary caregiver at home? And so this is an amazing question. I love this question. I'm an advocate for mental health, and so I love exercising. That's where I release my stress if I have any. I also like doing my nails, and I like taking showers by myself with nobody bothering me at times. And so I try to make sure to make these part of my priorities as well. And what self care practices do you implement to maintain your mental and physical health as a working mom and nurse? And so that kind of like piggybacks on what I was saying. I like to do that. I also love to travel. And so I travel. Do you find it challenging to switch off from work when you're home with your children? If so, how do you manage it? So, no, I don't find it difficult because as a nurse, you just clock out and you're no longer at work. Um, and I make sure that if I do have to handle something at work, like finish something or update the nurse practitioner or doctor about something, I make sure to have that finished with before clocking out and turning my attention to my children. Because, like I was saying before, you can do everything, just not at once. And if you work in a specialty like pediatrics, how does your personal experience as a mom influence your approach to patient care? I love this question because as a mom, it teaches you so many aspects that people take for granted. And I feel like I can relate to the parents because with pediatrics, as you may know, a lot of the things that you do in the patient visit, you have to direct it to the parent. And they're going to be over the child, kind of like a helicopter parent, which is totally normal. I'm a mom too. Um, and so just being able to approach them in an adequate way, it's very important. And the way you speak to them as well. So I feel like I kind of can relate to that. Do you find it easier to empathize with new parents in your role as a postpartum nurse due to your own experience? So I've actually never been a postpartum nurse before. I've worked in pediatrics before, but not as a postpartum nurse. How important is a strong support system like a partner, family, friends in helping your balance your roles as a nurse and a mom? So a support system is going to be important all the time, even if you're not a nurse. So just make sure that you have people that are helping you around you because that's going to be essential. It's really hard to do things on your own. Don't be prideful. And when you need help, ask for it. What advice would you give to new nurse moms about building a supported network at home and at work? And so I was kind of like touching on that earlier, just making sure that you have a good relationship with your coworkers, make sure that you find a supportive company, and make sure that you openly communicate with your spouse what your schedule looks like and what type of support you need from them. Do you feel that being a mom has impacted your career progression in nursing positively or negatively? I honestly would say that it can go both ways. For me, it has been positively because it has allowed me to look for more opportunities. Like if something wasn't available for me at a time because of something personal, I kept on doing more research. And so with that research, I was able to find more opportunities. And what strategies have you used to advocate for your career goals while balancing family responsibilities? And open communication. That's the simple answer. And that was it for today's Q&A for nurses that are also um, working and a mom at the same time. Thank you for joining.